presenting to you the catastrophe of Dracunculiasis along with my partner Kendall. So just some background information and history of the disease itself. Dracunculiasis is also known as beginning worm. It is a parasite that spreads through the consumption of water. Within the water, there are flea larvae, flea flies. And with the flea flies, they ingest the larvae. They ingest the larvae of the parasite. Dracunculiasis also can be found from the consumption of poorly cooked aquatic animals. This disease is common in locations such as rural areas or isolated communities that live off stagnant water, such as creeks, ponds, etc. Fortunately, the disease is on the verge of being eradicated. It's not fatal, but it can leave victims in a state of crippledness for about 10 through 14 months. In the mid-1980s, the disease started off very aggressive with the estimated number of 3.5 million cases in 20 different countries, with 3 being in Asia and 17 being in Africa. As time went on, alone numbers went down to 10,000 in 2007, to 542 in 2012, to 126 in 2014, to 22 in 2015, and 14 in 2023. Fortunately, the disease is on the verge of being eradicated. Now going into the life cycle and the transmission of the disease. So the way the disease works is after a year of the individual being affected, a painful blister emerges. These blisters are common on the lower leg, which produce a burning sensation. In order to relieve the discomfort, the individual will submerge their infected area in a body of water. When this happens, this allows the worm to release a number of baby larvae into the water, which are consumed by copepods. When an uninfected individual drinks from the same body of water that the copepods die, and while in the stomach, but the larvae from the worm doesn't, which then starts the infection. So with time, a female worm ranging from 60 to 100 millimeters will break through the intestinal wall and make its way through the body to the lower limbs of the infected. As the worm matures inside of the victim, it can reach up to 3 feet in length. So right here, I have a image representing on how this basically works. So right here, we have an individual drinking the water and consuming it. So once the person consumes the water, again, like I was mentioning before, the copepods will die off, but the larvae that are within the copepods won't. And then that's what starts the infection. So once that person is infected and they develop the worm inside their body and that blister emerges and it gives the individual a burning sensation, this drives the individual to put their body parts into water. And as soon as that happens, that's literally when the worm itself starts releasing a bunch of babies. And then that's how the cycle starts. Now moving on to the timeline of this disease. In 1980, the World Health Organization reached out to the CDC and asked of eradicating Dracunculiasis after seeing that it was developing into a serious problem. The Carter Center personally took a visit to a village in Africa and saw firsthand how the problem was, and which furthermore motivated action. At the time, there were 3.5 million cases. In the 1990s, the World Health Assembly agreed that worm disease must be eradicated. They decided to seek help from the President Zia al-Halak of Pakistan to accept their idea of eradication. At the time, there were 400,000 cases a year. From the years of 2000 to 2020, the World Health Organization and Pakistan's partnership led to the eradication of the worm disease in Asia in 2004. With knowing that these efforts are paying off, financial of $55 million was received from the Bill of Melinda Gates Foundation and Department for International Development in the UK in 2008. With success came with challenges, because while Asia became endemic, other locations such as Ghana still suffered with numbers continuing to go up. This led to the disease becoming public worldwide. Although with this setback, with further advancements in technology and understanding how the disease is spread, over time numbers depleted, leading to the verge of total eradication, which is estimated to be around the year of 2027. And then right here, I have a graph representing the timeline of Dracunculiasis. So as the years went on, going from 1980s to 2023, the numbers depleted down. So it's going in the right direction, and that's all I have for the timeline.
So a little bit about Fallout. So the global eradication campaign began in 1980. Since 1986, the campaign has been led by the Carter Center, like he mentioned. The total cost of the whole campaign to help end the disease since 1986 was $350 million. The campaign has helped to reduce the number of people affected by 98%. So that's a pretty good chance of people not having it. And before 2010, CGWEP, the Chad Worm Eradication Program, offered a cash reward of $100 to report a human affected with the disease. And I feel like they did that just to increase just knowing how many people had a disease, basically. I mean, for a cash reward, I mean, people's gonna report if they know somebody's got symptoms or has been affected or anything like that. Just so they could know how many actual people really had the disease. And the World Health Assembly, the WHA, in 2004 set a date to stop the transmission of the disease after the target date was not met. They set a new target to eradicate the disease by 2027. And I read there was a couple of reasons why the first date was not met. Mainly just because they just had more cases than they realized, and it just took longer to get rid of them or to cure them. And by the end of 2021, only 15 human cases were reported from 4 countries: Chad, Ethiopia, Maui, and South Sudan, compared to the 26 reported human cases in 2020. So within a year, it went down nine people decreased in a year. So that's pretty good. So anyways, and a little bit about the animal effects. In 2012, the disease was discovered in dogs in Chad. Since 2015, CGWEP also offered $20 for reporting a dog infected. Just like the humans, they also wanted to see the number of cases that was in animals as well. And obviously with money, humans is gonna report it if they see it just to get some money. And in 2021, there was reported 863 animals, mostly dogs, with the guinea worm infections, compared to the 1,102 infected animals in 2018 and the 1,601 affected animals in 2020. So as you can see, a little bit as the years is going on compared to 2019, which is the highest, to 2020 to 2021, you can tell that the practice is working by the amount of numbers decreasing. And I was curious, and I saw a little something about the actual months of the year when it was considered the highest. And I couldn't, this is with the humans and the dogs, I couldn't find a direct answer, but my guess would be, since obviously they're getting the disease through water, is in the hotter months for humans and the dogs. I would assume that the hotter months they're consuming more water, so that's why it's higher in certain months. That's just my speculation. And so a little bit about some of the recovery. There's no effective treatment or vaccine. There's only ways of prevention, such as you can educate people about the origin of the disease, how it's caused, what happens, stuff like that. You can prevent people from contaminating water sources. So a person that's already been contaminated, or a dog or any type of animal that has it, you can prevent them from contaminating other water sources to limit the risk. Okay. You can also filter the water. There was a couple different ways that I saw they filter the water: through pipes, through cloths. They had chemicals you can also put in water to help filter it. But the main thing that I saw as far as filtering water was pipes and cloths. There was probably 50-50 on which one they used. You can also another way you can get the diseases from eating aquatic animals that have not been cooked to a safe temperature. Mainly raw fish, that's what I saw a lot of it in. So a way to prevent that is to help, whenever you're eating aquatic animals, to make sure that you cook them thoroughly before consuming them. Another thing is pulling the worm out inch by inch is also a form of treatment, but it's a very painful way. I want to say that it said it could take up to 2 to 3 weeks to just pull out a worm, and they can grow up to, what was it, 3 feet? They can grow up to 3 feet. So I mean, imagine having something 3 foot being pulled out of you. And the ways I saw they would do that, they would take the worm and I guess pull a little bit out to get started, and they would like wrap it on sticks, and as it grows, they would wrap it and grow and just keep going. So I can imagine that's very painful. I mean, if it breaks off, then you got to start over again the process. So the recovery can, after you've had it, the recovery can take up to 10 to 14 months for the disease to be out of your system and break the life cycle. Like I said earlier, there's no real treatment or vaccine that you can get. So the only way to basically get rid of it is to have it out of your system for 10 to 14 months through not consuming water, or however way you get the disease, through the water, fish, whatever it is. As of today, the state of disaster is contained and under control with the ideas of the eradication of the disease in 2027. Kind of like Quan mentioned in the first couple slides, hopefully in the next couple years it should be gone, got rid of, should be eradicated in the next, 10, 15 years. No, I don't know what I'm thinking, another 4 or 5 years hopefully. So the problem is not considered solved yet, but with successful practices, we are currently on the recovery process. So like I mentioned before, the problem has not been solved, but it has very decreased over the past couple of years. So listen, in regards to full recovery, like I just mentioned, personally, we don't think that it's going to be a 100% chance of eradication of disease. You can decrease it tremendously to what it was compared to a couple of years ago, but we don't think that for 2 main reasons. The first being the remote areas don't have 100% clean water sources. Even in the U.S., we don't have clean water sources. Look at the amount of pollution we have over here. So compared to a rural country like that, whose economics, who's just, house, and just compared to the U.S., they're, I don't want to say inferior, not the people, but the places they live in, the places they eat, sleep, drink, are we're highly superior to them is what I'm trying to say. So I personally, how are you going to get rid, if you can't get rid of pollution in the United States, and it's very superior as far as the water being filtered and everything, how are you going to get rid of it in a rural country like that? That's just our opinion.
It just makes them a lot more susceptible.
Yes, it makes it a lot more susceptible to getting the disease. The second, because there's no dedicated cure to the disease. Like I said before, I mean, there's ways to prevent it, but there's no cure. Once you have it, the only way to get rid of it is basically time. I mean, just to have it out of your system 10 to 15 or 14 months. So I don't think it can be 100% eradicated. Quan doesn't either, but that's just our opinions. And we got a little video for y'all if you want to click on it. Quan. Yeah.
After a 20-year campaign started by former President Jimmy Carter, the end of guinea worm disease is now within reach.
I became obsessed almost with the prospect that the Carter Center could be successful in eradicating the disease. One country by one, we are adding up all the nations that will never see guinea worm again.
For thousands of years, this parasite has caused disabling misery in Africa and Asia.
It's a disease of poverty. It affects very disenfranchised populations. And I think when President Carter became involved, he really pushed to make this a national agenda for many of the countries that were endemic.
In 1986, there were some 3.5 million cases of guinea worm in 20 countries. But after health authorities succeeded in stopping transmission in a growing number of areas, by the beginning of 2006, there were fewer than 11,000 cases of guinea worm, all of them in only 9 countries in Africa, concentrated in Ghana and Sudan.
Huge progress has been made. It's over a 99% reduction in cases. The remaining populations are some of the more challenging populations, obviously, when you get down to the last number of cases.
In poor, remote areas, guinea worm is contracted by drinking water contaminated with microscopic fleas carrying the worm's larvae. Inside the victim's body, the larvae grow into mature worms as long as 3 feet, after about 1 year emerging through agonizingly painful blisters in the skin.
It feels like a hot coal on your skin, and that sort of compels a person to walk into water to cool that burning sensation. And when they do that, the water acts like a trigger and the worm releases tens of thousands of larvae into the water source.
And that's when the worm's life cycle starts again. There is no cure for this, and the only treatment is wrapping the worm around a stick and pulling it out inch by inch, a slow and painful process that can take weeks.
It's very painful, very long. It takes several weeks to 2 or 3 months for the worms to come out, and so people are crippled. So children can't walk to school, farmers can't farm, parents can't take care of their toddlers.
It's very serious, but I think people need to really appreciate the seriousness of the problem.
The current Miss Ghana grew up in a guinea worm area and has made its eradication one of her major causes.
It's bad because of the stigma attached to it, the pain, the suffering. I mean, the wound alone, I just can't imagine that somebody actually carries this thing around, and it can appear anywhere on the body. It can appear anywhere.
The only way to stop guinea worm disease is to break its life cycle for at least 1 year.
We can prevent it, help people prevent it, by teaching them not to contaminate the water when they have these worms coming out of their body, by helping them to learn how to filter their water through a finely woven cloth, their drinking water, and by putting a chemical in the water to kill the parasite in the water, or by helping them to get safe drinking water from underground wells.
But these measures work only when supported by effective health education, including creative programs that entertain yet deliver the serious message that these communities have the power to defeat guinea worm. All the countries that still have this disease are working to stop its transmission by the end of the decade. Their success would make guinea worm the second disease in human history after smallpox to have been globally eradicated.
You take us back. So a little bit of the lessons learned that we could take through this disease. Since the outbreak, health education has been stressed, as well as the use of both cloth and pipe filters to help treat water, like I previously stated. And if people don't know, especially in rural areas, if they don't know that it's there, I mean, they got to drink water. I mean, it's common sense. But also, like I also stated, cooking fish thoroughly and warning kids to not consume raw fish has also been a big topic up for discussion, and especially in all these countries, they eat a lot of or consume a lot of raw fish, so it's been a very big topic. Should they do it? Should they not? Also, an increase in the number of ponds treated went from 312 ponds in GOG in July of 2017 to 819 ponds treated in July of 2021. Like I said, they actually trying to treat the water. Also, they have used GPS collars, have also been used to help track infected bamboos and to treat the water source that they use. I didn't find nothing about the process of how they actually get the collars on the bamboos. I mean, I'd assume they don't know if they trapped them or sedated them or uses some type of sedation dart in a gun. I couldn't find nothing like that. But I just know that they end up putting collars on them so they can. Obviously, if they know the bamboon has been infected with a disease, they're going to trace it back to the water, and that water source has been contaminated. So they can shut it down, treat it, or just, try to figure out something to do with it. In April of 2018, Ethiopian villages decided to tie up / restrain all dogs and cats in peak transmission seasons to keep them from contaminating water sources. Then again, like a human, I mean, you can tell a person to not contaminate the water, but animals don't understand that. So they was also having big problems with animals contaminating their water source. So they decided to tie them up, restrain them, especially through the peak season, like I was talking about earlier, which was the summer. And I couldn't find a reason why, but I just assumed because it's hot and animals and people are drinking more water. Also, veterinarian care was also introduced for animals. They still don't have a cure for it in animals, but just like humans, as a way to prevent it if you do get it. They can also pour the worms out of animals. I saw them do that. And the World Health Organization, the WHO, helped to train 1,400 health professionals in guinea worm prevention in 2019. They also helped train more people virtually in 2020 and 2021. Like I stated earlier, just educating people what it is, where it is, what to do if they get it. Also, the program also reduced the disease in humans globally by 51% between 2019 and 2020, and by another 44% between 2020 2021. 51 to 44, that gives you roughly 95%. Like I said earlier, 98% of it's basically been gone as far as up until I think it was 2022. So it's pretty much gone. I mean, I still don't think you can fully get rid of it. What are some next steps that we can do? Ways of prevention is having better water sources. I mean, like I said, it all goes back to the idea of people in rural areas, they don't have the same water sources that we have, clean. So, I mean, if you can make the water sources better for them to consume, then it's going to overall help the effect. They can also educate rural countries of water quality and how to prevent the spread of waterborne diseases. Goes back to the same idea, educate. If they don't know, how are people going to know it's there? I mean, it's common sense. Right. Better filtering practices, that goes along with the prevention as well of the water sources. Even if the water itself does have it, they can also filter it out of the water to get clean drinking water. And you can start moving into works of finding a cure. I didn't read or see nothing about a cure even been thought of. Did you? You see anything about a cure?
No, I didn't see anything.
So I didn't see nothing of, I don't know, a cure being thought of, or they thought they had one, nothing. So I mean, they need, if they can find a cure for it, that would help them out. And down here, I have no idea what, there you go. Down here is just two little kids reading a little book about the disease, educating themselves, just so they know. Over here you got a group of, or two guys reading to a group of a village, I assume, educating them about what the disease is, how to prevent it, and just learning about it overall. And a couple more pictures. This was before the actual worm comes out. So this person has been contaminated with the disease, and a couple months later it ends up actually bursting out through the skin. And like I said, they take a stick and wrap it up on it and tie it out, pull it out a little bit, wrap it, pull it out a little bit. And it's very painful. I couldn't imagine having that done on me. Same thing with a dog. Like I said down here, they used to just let them come out, the dogs, but like I said, they started getting veterinary practices to help do the same thing they're able to do with humans. And even now they're actually starting to dabble a little bit with operating on the dogs. I couldn't find nothing else but this one picture and a little bit about it, so I don't know much about how that's going. And a little bit on work cited, and that's our presentation, so I hope y'all enjoyed it.